So when they do this, I actually want to tell them to actively push their knee down into the pad. And as long as they're doing that, they should feel their glute med working.
In this video, I'm going to be talking about the side plank and the progressions beyond that into a side plank leg raise, a banded side plank leg raise, and all those progressions. It is an exercise I really like using for glute med strengthening. You know, a lot of times traditionally the side plank is utilized for core strengthening, which is perfectly fine to utilize. But in regards to ACL rehab, I do think you actually get a lot of information from a side plank, which can be missed if you're not really training the glute med too often. You know, I've talked about the importance of glute med strengthening, utilizing ankle weights or Captain Morgans or bands or anything like that. But I do think the side plank can really expose athletes and show some discrepancies between the two sides. So I'm going to go over the kind of the general progressions of the exercises in regards to starting from kind of level 1 and working way all the way up to the really high level ones. So I personally like to utilize, at least initially, a pad when they're doing the side plank, just because a lot of people, especially when they're on their knees, don't really find it too comfortable on the ground. So just a subtle thing is that I like to utilize a pad. So at first, you know, we talk about shorter lever arms. So I typically will start with just a side plank here and hold here. So when they do this, I actually want to tell them to actively push their knee down into the pad. And as long as they're doing that, they should feel their glute med working, okay? And if you want to progress that, you can progress to a hold here, making sure they stay up. You can obviously even go longer lever arm here too. Either way, they should still be actively pushing down. What you don't want to see is, and this is consistent with every single progression that we go through, is that you don't want to see the hip down. Because a lot of times if you make it too hard too early, you're going to start noticing that their hip's going to start dipping down because it's too hard for them to, they can't basically utilize their glutes to keep their body up. So if you progress and you're like, okay, let's try and go the longer lever arm hold, and you start seeing that they're sagging down to here, that's because they're getting, that means that they're getting too weak and that you have to regress down to either shorter, or you just stay at the hold, making sure they can sustain that and then build from there, okay? So that's the general progression. So you want to start for side plank, short lever arm hold, long lever arm hold, okay? And from here, I personally like to go to a band. And the band's gonna be in a sense, the same two that we just did. You can go into a side plank leg raise or a side plank clam. So here, you can go here. That's gonna be a little harder. You can also lift off to more abduction and then pulse that way. And then of course you can go into the longer lever arm hold. Okay, again, you want to make sure that they're not sagging and you're not dropping their hips at all. Another big compensation is that you don't want to see their hips turn. I will say this is probably the most common one, particularly when you get to the higher level ones. Because you want to stay in a pure abduction plane, that's the whole purpose of the exercise, to work on the hip abductors. If it gets too hard, you're going to start noticing that they're going to start twisting. Most of the time, most of the time it's either backwards, but they might tilt forward too. Either way, again, even if you try it yourself, as soon as you do, if I'm holding here, I feel a lot of my glute med. As soon as I turn like this, it looks fairly similar, but this is substantially easier. Even just as subtle, right there, my glute is on fire. That is not a lot of glute med, okay? Again, I encourage you guys to try these out so you can get a feel for it. So yeah, from there, we might progress to a full side plank. So here you might utilize this for your elbow instead. So here, full side plank, hold, okay? Again, actively pushing that foot into the ground. If they can't do this, again, you might think about progressing. For this one, what you'll notice, I actually want their entire calf off the ground as well. So if they're doing this and they're holding it for like 2 seconds, you start noticing that they're sagging down like this, you know, their hips still kind of up, but their calves are down. You might want to think about regressing that a little bit, okay? And much like the shorter lever or shorter knees bent version of the side plank, progressions are very similar, where you go here,
full, hold, or you can go raise this. Okay? And again, you want to make sure that they are not cheating their hips back and forth. I will say this is without a doubt, this is going to be the one that you see the most hip compensation on as far as that rotation goes, because they're really trying to take pressure off of the hip. And for the most part, people are actually going to feel it harder with their ACL side on the bottom, because the bottom hip is the one doing most of the work. You know, a lot of times they think that because if you choose a side plank leg raise and the top, they think that you're working at the top leg because it's the one that's moving. However, when your leg is in the air, the bottom leg, the bottom hip is the one that's keeping your entire body weight up off the ground, which is why you're going to start noticing these hip twists or hip drops when they're doing these. So I'm very particular in making sure they do these very, very well and understanding what they should be feeling. So again, if you feel like they can't do the full plank version, regress down to the kneeling version and then build up from there before they get to the full side plank. The hardest version of this one, you can either go banded. I'm gonna struggle with these, to be honest. The banded full side plank, which is really, really hard, where you can obviously even add an ankle weight as well, but usually bands are a little bit more accessible. And you can even, I'm gonna regress this just for myself so I don't embarrass myself, at the knee level, right? So here, full side plank, raises, and that's gonna get your glute med pretty challenged. And you can obviously progress that down to your ankles and push from there. And that's gonna be really, really hard to sustain that, okay? So yeah, that's the general progressions and regressions of the side plank, starting from kneeling all the way to the straight legged with the band. You know, you can play with the nuances as far as like what's a 1-step or 2-step progression, or what's a 1 or 2-step regression. But either way, that's a general progression of how you can work your athletes through that. And again, the biggest compensation that you're looking for is whether or not they can sustain that in pure abduction, as opposed to they start adding a rotational component to it, or they're too weak and their hips start to drop. Those are probably the two biggest compensations that you'll see. So if you start noticing those, or both of them, you want to make sure you're thinking about regressing that back down, dropping it down to whatever version you feel like is fitting for your patient. So yeah, hope you guys found this video helpful. Thank you for watching today's video. Please feel free to like and subscribe and share it on your social media platforms. If you're interested, I have started an ACL Mastermind group, which is a growing library of content centered around ACL rehab. It has exercises ranging from immediate post-op to late-stage sports-specific movements and everything in between. It's a growing library and currently holds over 250 videos. There's content centered around assessments, movement breakdowns, exercise breakdowns, case studies, and a whole lot more. You also gain access to a private forum where you can engage with like-minded people, ask questions, share research articles, and share resources. If you're interested, please feel free to click the link below. Thank you for watching.